some of these studies have actually informed our response here in the country. When we focus back here in Kenya, and as we carry out our research, we're key to answer certain key questions. For example, how can we characterize the pandemic here in Kenya? Is the pandemic in Kenya any different from what is happening in other countries? Who is being affected when it comes to our symptomatic cases? Who then proceeds to develop symptoms? How long does it take before someone moves perhaps from an asymptomatic stage to a symptomatic stage? What does it look like when we talk about severity of symptoms in Kenya? Who is dying from COVID-19 in Kenya? What risk factors are involved? And then, of course, when it comes to the management of COVID-19, what interventions have been successful when it comes to managing COVID-19? What has contributed to the successful containment of COVID-19 in Kenya? Are some of our management practices reducing the morbidity or mortality of COVID-19 in Kenya? And so in collaboration with various research organizations, including universities, including Kenya Medical Research Institute, and the Kenya AIDS Vaccine Initiative, Kenya has participated and continues to participate in local and international collaborative COVID-19 researches. And the ministry continues to follow up as we continuously collect data in terms of our infected patients, exposed persons within the country. All this information is being used to develop a robust COVID-19 management strategy. And as we draw lessons from this, we are looking at investing further in research and development in the country. We are looking to see through the Health Act, implementation of the National Research Fund, which then will create several opportunities for COVID-19 research within the country, and also looking at engaging more at the bilateral and multilateral level to be able to inspire and resource more research activities. Currently, we do have some progress. It's important to note Kenya is participating in several clinical trials. We are participating in, amongst others, and aside from COVID, the HIV vaccine trial, having made a lot of headway through CAVI here in Kenya. We're looking at research that deals with Ebola, research that deals with other therapeutic trials of different other vaccines and initiatives within the country. We've gone ahead as a country and conducted COVID-19 genome sequencing. What this means is that we've been able to pick our COVID-19 cases within the country, and we've been able to study the DNA, the RNA that makes up this virus to be able to understand it. We've been able to look at research when it comes to molecular immunology to see, is there a different response that Kenyans have when it comes to building immunity against COVID-19? We continue to also do research when it comes to non-communicable diseases. There's research ongoing in terms of cancer, research ongoing when it comes to stem cell therapy, regenerative medicine. Most recently, in the past 2 weeks, we've been developing a study protocol that will look at the use of plasma. This means we will be taking the blood of someone who has recovered from COVID-19 and trying to use it as a medicine for those who have moderate cases of COVID-19. So there's a lot that we're doing as a country when it comes to research. Of course, we continue to do epidemiological research to be able to understand the patterns of this disease, how it spreads. As you're all aware, we have a robust team that has been conducting epidemiological modeling, and they continue to collaborate with the Ministry of Health to inform us. We have also undertaken health systems research. What has been the effect of COVID when it comes to other essential medical services in the country? What is the cost of managing a COVID case? How has COVID impacted issues that deal with health insurance? How has COVID impacted our society? Has there been any economic impact of COVID that touches on the health sector? We've gone ahead at KEMRI. I'm aware that they continue to review and conduct validation for diagnostic kits for COVID-19. And so a lot really has been contributed through research in Kenya. Now, turning on to our COVID-19 statistics today, we have recorded 379 new cases, raising the country's total to 31,015 cases. And this was drawn from a sample of 3,867 people within the last 24 hours. Of our positive cases, 372 are Kenyans, whereas 7 are foreigners. And in terms of gender, 223 are male, whereas 156 are female. The youngest is a 1-year-old baby, while the oldest is 87. In terms of distribution by county, Nairobi leads with 219. Kiambu has since taken the second position at 40. Uasin Gishu 28. Kajiado 14. Machakos 13. Kisumu 10. Mombasa and Kericho having 7, with Kericho 6. Bomet, Baringo having 5. Nandi, Nyeri having 4. Isiolo 3, Narok 3, Busia 2, Garissa 2, Homa Bay and Kilifi also having 2 cases. 1 in Kirinyaga, Kisii, Laikipia, Makueni, Nyamira, Taita Taveta and Trans Nzoia all have 1 case. We have provided the disaggregation in terms of county, and we'll provide that to you to be able to see what it looks like at the sub-county level. In terms of our recoveries, today, we have 244 patients that have recovered from the disease, bringing the total number of recoveries to 17,612. And from the discharge, 76 were from various facilities, whereas 168 were from the home-based care program. And we continue to thank our healthcare workers for this great achievement. Unfortunately, today, we've lost 19 patients to COVID-19. One of these patients was a death that happened in the household, in the community. And today, as we've continuously said, 18 of our patients all have comorbid states, with the 2 leading states being diabetes and hypertension. We continue to extend our sincere and heartfelt condolences to the families and friends of those who've lost their loved ones. We thank you, and we now can have a question and answer session.
My name is Mutanu from the Daily Nation. I have 3 questions. Why is our COVID-19 strategy failing? Because if we look at the way we are doing contact tracing, it's almost it is not visible, the contact tracing program. And also, why are samples which we are testing every day are falling? And again, where are the reagents? Yeah, some institutions like Emory are saying that they do not have testing reagents. And in terms of epidemiology, how is the curve right now? Thank you.
Thank you. I'm Purity Muse from KBC. My question is, now, since March, we are still reporting cases of COVID-19 with the daily briefings, of course, and 47 counties have been affected. What is the, let me not say end game of this, but what is the plan by the government, through the Ministry of Health, to stop the spread of coronavirus, because all the 47 counties have been affected? The strategy, because we are seeing now the samples that are being taken, the number of the samples has reduced. So where are we headed? What is the challenge, and how do we overcome this? Is it something that has overwhelmed the ministry, or what is the plan with the reduced samples that are being tested every single day?
My name is Nancy Mwe, Milele FM. 2 questions. One, about the state of the Nairobi County doctors. Last week they offered a 1-week ultimatum, but today, as I was speaking to some of these doctors, they're saying they're receiving threatening messages and calls asking them to either go down with a strike, or rather they will be dismissed from their jobs. And 2, as we're using our local or the matatus, we have noticed the 2 guys sitting in the same seat is now back. And when you confront these people and ask, why am I even sitting with someone else, they tell you either get out of the matatu, or you have no any other alternative. Thank you.
Thank you.
Helen Aura from NTV. 2 questions as well. The first question, can you ascertain that that PPE kits in the country right now being distributed are of good quality? And my second question is, you said the virus is mutating among us. From the research so far, can you elaborate and be able to explain why? Right now we see a lot of cases of young people being the ones who are most affected, as the message was before, comparing to those who are older with underlying conditions, yet these young people do not really have any underlying conditions.
Thank you. Thank you all for your questions. I'll begin with Helen's last question. Is the virus mutating? One, I'd like to correct that. What we're saying is that we've now established what is known as community transmission. And what this means is that the virus has spread within our communities to the extent where if you are to follow one case within the community, you may not be able to determine a true exposure of that case. If you remember when we started dealing with COVID-19, we had perhaps some people coming in, perhaps imported cases. It was at that point easy to be able to trace that Mercy came in from the UK, Mercy was with Helen and Jane, Helen has tested positive, so we were able to sort of have a chain of transmission and determining. That has changed. Right now, when we find our positive cases, it is extremely difficult, if not impossible, to be able to determine who their area or, area contacts or level exposures were. That's what we mean by community transmission. When you talk about a virus mutating, you're talking about a virus changing its genotype, what it is in terms of the makeup of a virus. That we've not experienced in Kenya. Like I said, I have actually seen the study that was conducted by Kemri Wellcome Trust, where they were able to take different samples of COVID-19 across the country and type and, do a genetic mapping of that virus. And what we found is that our virus remains the same. It is very characteristic of the virus that is identified, in different countries across the world, and that within Kenya, there's very little disparities, if any, between a virus sample collected in Nairobi and one in Mombasa, one in Kakamega. In other words, our virus is not mutating. However, you raise an important point, Helen, that yes, we are seeing now more and more cases amongst young people. And remember today, focusing on research, we continue to ask ourselves, is there anything different when it comes to what is happening in terms of transmission of the virus in young people in Kenya? What we've noticed, and scientists are continuing to study this, is that there is a laxity when it comes to ensuring that you're protecting yourself as a young person. Perhaps it seems that the older population in the country has taken heed and is actually shielding themselves, they're protecting themselves, and that they're actually following these measures in terms of adherence to a higher level compared to young people. That being said, like I mentioned today, out of our cases, I remember looking at the report, about 18 of them have comorbid states. And today I was remarking that we have a 28-year-old who's passed on, who's diabetic. So really what it means is that we need to be careful. Remember, we've highlighted that COVID-19 is a new disease, a disease that we're trying to understand with each new day. And the interesting phenomenon that is happening right now is that COVID-19 is being seen to sort of stimulate a form of high blood sugar. So that means you could be young, you could be okay, but perhaps this disease, being a multisystemic disease, can actually have effects on other organs within your body. Now, there's a question here, and I want to tie it in with, before I get to the PPE question, with what Purity has asked and what I think we had a question also from Daily Nation on what is exactly the COVID-19 strategy. Is it failing? Why is contact tracing not being felt? I've seen a question again concerning the matatus and the sitting, in terms of people not adhering to these measures. And to say that COVID-19 strategy really, like we've said today, is a strategy that is very clear. Kenya is following the mantra that we've often talked about, that you're trying to trace cases, that you're trying to isolate cases, that you're trying to treat cases, and you're trying to, ensure that you're following that pathway when it comes to COVID-19 management. Now, what is interesting is that as the disease evolves, Kenya is no different in terms of other country experiences. We've had conversations with different organizations such as Africa CDC and WHO, and now I'm pointing out to the Daily Nation question. And the biggest question at hand in America, the biggest question at hand in Kenya is, how do you actually sustain proper contact tracing, appreciating that contact tracing is a very resource-intensive exercise, and also with our scientists telling us that when it comes to community transmission, you actually have to change your contact tracing approach. And so in the beginning of the pandemic, like I mentioned, if Mercy has come in from the UK and I had dinner with Helen and Susan, I would easily give the contacts of Helen and Susan. We would go capture Helen, perhaps put her in some form of isolation, and continue managing the pandemic. That has changed, fellow Kenyans. Africa CDC informs us that perhaps when it comes to contact tracing, when you've established community transmission, you need to relook at your approach because it would be futile, because the disease is within the community. It has already spread, and contact tracing then, and in terms of its merits, becomes a little bit weaker. However, there's a disclaimer there, and the disclaimer is that as countries reassess their contact tracing approach, that then perhaps they need to contact trace not the whole of, the community, but people who, are more vulnerable and susceptible. And so the idea is to be able to find out, who is that person who we must absolutely get. What are those events? For example, say a church event. If someone is, attending a church service and they're singing, that then becomes an important cluster to ensure that we are contact tracing. But doing contact tracing as we did in the beginning, unfortunately, is not feasible. And this is the same experience that different countries are having. In terms of our strategy purity, yes, I do hear your frustrations. These are the same frustrations that we've had from different people in the citizenry. What is our end game? Are we succeeding? Are we overwhelmed? One, I can tell you we are not overwhelmed. We are actually being able to manage this pandemic, and we are in a place of progress. Yesterday I saw questions concerning, are we flattening the curve? No, we are not flattening the curve. According to our statistics, our daily summary statistics, our research when it comes to prevalence of this disease, we are well aware that our curve has not yet flattened. Yes, there are challenges when it comes to, the daily tests that we're doing. We are experiencing, as we've mentioned, disruptions in terms of reagents, being able to get those supply chains sorted. But this is something that we are managing. Camry, next week, will actually be getting a batch of reagents coming in. And so this situation will normalize by next week, and we'll be able to get back to our previous numbers of testing and sampling. And as we look into the future, and we really did try to touch on this in terms of our briefing, what is the end game? What does it look like? One, for us to all remember, this is a new normal. Things may never get back to the way they were before coronavirus hit us. But then in this new, dispensation of a pandemic, we then need to learn how to live with it. And as a sector, as a Ministry of Health, we are looking to see public health security is now one of the key program areas in the Ministry of Health, considering and learning that pandemics continue to reoccur. So it is most likely that there will be another one and another one coming. And so what we're doing as a Ministry of Health is to look at that program area to be able to ensure it is well-resourced, to ensure it is well-institutionalized, to ensure that there's national and county government collaboration. And there's numerous lessons that we've learned while managing this pandemic that we hope to streamline when it comes to our response. Someone did ask, what does the curve look like? I think tomorrow what we will do is we will actually have the curve drawn, because this is a question that we've been asked over and over by members of the Fourth Estate. So tomorrow we'll share some summary statistics as part of the daily presser. But I can tell you the curve continues to peak. Yes, you may see that we have, fewer numbers being tested. But remember, a curve is not just the sample sizes or the numbers that we report daily. There are other studies that we are triangulating to be able to actually model our epidemiological curve. I think the last question was from Nancy, who asked a question on the situation in NMS and the issue of the strike. I'm briefed by the team in NMS that they continue to engage the union in terms of trying to address the issues that were raised. I've also seen communication, particularly on the issue that deals with medical insurance. The discussions are underway, budgets have been availed, and this issue will be dealt with. A cover will be provided under NHIF for the healthcare workers. The issue of threats, I think that should be reported. We are a country that follows the law, so if anyone has been threatened, they should go to the right authorities and report that. Again, in terms of sitting, Remember, we've always said we are all duty-bound to take care of each other. Yes, we shall continue to engage the matatu industry. I think this calls for another sitting with the stakeholders to be able to define why there is need to observe these adherence measures. But at the same time, as a Kenyan, the choice is yours to get into that matatu or not. And so we really do continue to ask you all, if you find that they're not adhering to the measures, find an alternative. Otherwise, you'd be gambling with your own life, really, at the end of it all. There's a question on PPEs. Helen asks, can we ascertain that the PPEs are of good quality? And I think last week we were able to share with you the very elaborate mechanism that is undertaken while reviewing PPEs, ensuring that they are of good quality. Now, we all buy phones, we all buy gadgets. As you all know, when it comes to good manufacturing practice, perhaps you've bought an Android phone or a Samsung phone and, the microphone is off. That can happen when it comes to PPEs. What we are saying is that then should a healthcare worker come across PPEs that are defective, and I'm happy in the past week I've actually had 2 or 3 people bring some PPEs to us, then bring them, don't use them, bring them, and of course there'd be a replacement mechanism to ensure that you have the right kit. That being said, we continue to collaborate with KEBS to ensure that the PPEs are of good quality and are availed to our healthcare workers. I think I've touched on most questions. I'll ask Dr. Kibias to perhaps elaborate a little bit further on the epidemiology of the disease.
Thank you, Chief Administrative Secretary. I think you have rightfully stated the way it is. I think the general trend of the epidemiological curve of COVID-19 within our country is still on the rise, so it's not yet peaked, and that's how it is. And there was an issue about a breach of the seating arrangements in our public transport system. I think that's a very unfortunate situation because we still emphasize the fact that we must still maintain the public health measures to ensure that we continue to the containment measures of the COVID-19 in our country. This is the time to even adhere more to the set regulations because this is a time when there is a lot of community transmission, as you have already been informed. So we cannot afford to take chances at this time. Otherwise, we will be taking ourselves back again. Thank you so much.
Thank you so much. And so as promised, tomorrow we'll get into the statistics of things. We'll have the curve ready for you. We'll discuss positivity rates. And then, of course, assure you that we are in control of the situation. Thank you.